Namaste everyone, a warm welcome from Rashtrotana Hospital. I am Dr. Vishwanath Sanagaudar, pediatric intensivist at Rashtrotana Hospital. Today we will talk about dengue fever in children. So what are the common symptoms, warning signs and how to prevent dengue fever. So dengue fever is a seasonal viral illness caused by a vector called Aedes aegypti mosquito, and it is caused by a virus called dengue virus. There are mainly 4 serotypes of dengue virus. So this dengue fever is more common during and after the rainy season because of stagnation of water, which helps in breeding the mosquito. So coming to the vector per se, that is Aedes aegypti mosquito. So this Aedes aegypti mosquito is a small blackish mosquito with white strips on its body and limbs. This, in layman terms, we also call it as a tiger mosquito. This mosquito is a daytime feeder, that is, it bites in the daytime, that is in the morning hours and in the evening before it is dark. So it breeds both indoor and outdoor. In indoor places, wherever there is congestion, like in shelves, cupboards, and in racks where we keep our clothes. So these the mosquito hides in these places. And in outdoor places, like wherever there is stagnation of water, that is rainwater. So that is the main breeding place of this virus. So most of the people have misconception about dengue fever, that it spreads from person to person. So to make it clear, it doesn't spread from person to person directly, but it spreads by the bite of mosquito. For example, an infected person, when bitten by the mosquito is capable of transmitting it to other persons through its bites. Okay, so the infected person is infective to other persons for about 7 days. So during this time, he can spread it to other persons through the mosquito bite, not directly. Fine. So let's discuss about the clinical features in children. That is, what are the signs and symptoms the children manifest with dengue fever. So the clinical course of dengue fever runs in 3 phases. The first one is febrile phase. So in this febrile phase, the older children present with sudden onset of high grade fever. The fever may be as high as 104 to 105 degree Fahrenheit. The other common symptoms are headache, body ache, pain behind the eyes. There may be a clinical rash, red colored rash over the body, some nausea and vomiting symptoms. And there may be, in children, there may be enlargement of glands and lymph nodes in the over the body. So in smaller infants, that is 3 months to 6 months infants, they manifest with non-specific symptoms. That is, they may not manifest with high-grade fever, but they may manifest with hypothermia, that is, low grade of temperature, as low as 96 degree Fahrenheit. Along with that, there may be excessive sleepiness, decreased food intake, and irritability. Due to these non-specific symptoms, which mimic other childhood infections, it is a little difficult to diagnose dengue fever clinically in these infants. So a high degree of suspicion should be kept in these infants while diagnosing dengue fever. So the next phase is the critical phase, also called as phase of plasma leakage. So the plasma leakage from the blood vessel happens in dengue fever, and this is the main factor causing most of the complications in dengue fever. So after the febrile phase, most of the children recover and they are called dengue without warning signs. Whereas some children go into critical phase and they manifest with warning signs. They are called dengue with warning signs. So if warning signs are not treated at the earliest, they may progress to severe dengue, which is a little difficult to manage also. So coming to warning signs. So what are the warning signs which should alert the parents to reach to the doctor as early as possible? The child may, after the fever subsides, the child may manifest with persistent abdominal pain, persistent vomiting. There may be bleeding in the mucosa, or there may be black colored stools called melena, which indicates bleeding. And there may be clinical fluid accumulation, for example, edema or puffiness around the eyes, fluid accumulation around the lungs causing rapid breathing, and fluid accumulation in the peritoneum causing distended abdomen. And in small infants there may be lethargy and restlessness, that is irritability. And coming to lab values, there may be sudden increase in something called hematocrit or sudden fall in the platelet counts. So these are the warning signs which should alert the parents to take the child to the pediatrician. So if the warning signs are not tackled at the earliest, the child may progress to severe dengue. In severe dengue, the child may have shock, that is lower blood pressure, and there may be multi-organ failure, that is failure of liver which may cause jaundice, failure of kidney which may cause decreased urine output, and there may be central nervous system, that is brain involvement, which may occur at a later stage, and there may be decrease in the level of consciousness of the child. So once this critical phase is managed well, the children may progress to recovery phase later. So in recovery phase, the general well-being of the child improves. Then there may be clinical rash with itching, which is a sign of recovery in dengue fever. And the hemodynamic status, that is blood pressure, improves. And the diuresis happens here, that is the leaked fluid from the plasma is reabsorbed back into the vascular space and the urine output improves. Okay, so these are the signs of recovery phase, and the laboratory values are the late to recover, and the platelet count is the last one to recover in recovery phase. So coming to treatment part, the mild symptoms, that is mild forms of dengue, can be managed at home with fever control measures and lot of oral liquids and soft diet. Whereas severe dengue, that is dengue with warning signs, so these children may have to be managed in the hospital, and appropriate investigations and treatment may be required. So coming to the most important part, that is prevention of dengue fever. So the prevention includes indoor measures and outdoor measures. So in indoor measures, we have personal protection and household protection. So personal protective measures include wearing of long sleeves and pants during bite times, that is in the morning and evening hours before it is dark, and use of mosquito repellent creams and sprays. So when we say these repellent creams and sprays, they have to be used very cautiously in smaller infants and children under doctor's advice. So if you are using a spray, it should be in a well ventilated room, and you should avoid contact with eyes, nose and mouth. So coming to household measures, the most common household measures used are mosquito nets and barrier techniques, so which are more useful in preventing entry of mosquito into the household. So outdoor measures are as important as indoor measures, and they include prevention of stagnation of water, for example in flower pots, or stagnation of rainwater in potholes or in the gutter in and around the house, which are the places of breeding of this mosquito. The other important thing is waste management. Waste management both inside and outside the hospital is very important in preventing the breeding of these mosquitoes. And in conclusion, mild dengue symptoms can be managed at home with fever control measures and good oral intake. The dengue fever with warning signs need immediate attention, and the parent should take the child to the hospital as early as possible to prevent further complications and get it treated. The last thing is prevention. The prevention is always better than cure. Follow preventive measures to prevent entry of mosquito and biting of mosquitoes. So this was a brief idea about dengue fever, the symptoms, warning signs and prevention of dengue fever. So at our hospital, that is Rashtrotana Hospital, we have a full-fledged department of pediatrics, where there are 3 consultants who manage OPD services, IPD services, neonatal ICU, pediatric emergency services. So it is well supported by qualified and experienced nursing staff who are capable of handling sick neonates and children. So all our services are available 24/7, including consultant visits. So we also have laboratory services and radiological services, including ultrasonography and CT scans. So in our ICU is capable of handling any sick children, including ventilatory services. So thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.